Okay, hello everyone. So this is going to be the recorded lecture for chapter 19, infection of the nervous system. So when we think about the nervous system, it's actually composed of two parts: the central nervous system, which includes your brain and spinal cord, and then the peripheral nervous system. These are all of the nerves emanating from the brain and spinal cord, essentially to all aspects of the body. And the function of the nervous system is that it will detect sensory information, both external and internal, relay that information to the central nervous system where it'll get integrated, and then, if necessary, will come up with some type of response, which could involve using muscles or glands. So the brain and spinal cord are made up of neurons surrounded by bone. The brain is inside the skull, and the spinal cord is inside the spinal column. In addition, these two structures are surrounded by structures called meninges, and there are three layers to the meninges. We have the dura mater, which is the outermost layer. This is the most durable. The arachnoid mater, and then the pia mater, which is directly attached to the brain and spinal cord tissue. Cerebrospinal fluid. This is fluid that fills the subarachnoid space. It is clear serum-like fluid, provides nutrition to the central nervous system. It also provides an avenue for removal of metabolic waste from the central nervous system. In addition, it provides a liquid cushion for the brain and spinal cord. And meningitis is actually an infection of the meninges and oftentimes the cerebrospinal fluid, because the arachnoid mater is really located in this space where we find CSF. One way that they can test for meningitis is to actually do a spinal tap and analyze the CSF. Now, the structure of the peripheral nervous system, you have ganglia, which are swelling in the nerve where the cell bodies of neurons will congregate. And nerves are bundles of axons that receive and transmit nerve signals. Axons and dendrites of adjacent neurons communicate over synapses, and neurotransmitters released from one cell act on the cell synapse of another. And we'll talk about a couple particular organisms that can actually affect this, this action of the neurotransmitters binding at the synapse. It can actually lead to things like paralysis. Now, the defense mechanisms for the nervous system are mainly structural. You do have the bony casing of the skull and the vertebral column. And this is really just going to protect from traumatic injury. CSF serves as a cushion against impact. And then we do have the blood-brain barrier. Now, the blood-brain barrier is probably your most important aspect here. The blood-brain barrier consists of cells that make up the walls of the blood vessels around the brain, and it's very restrictive. It's highly selective. It will determine what can leave the blood and what cannot leave the blood. You have freer passage of ions, sugars, and other metabolites in other areas of the body than you would with the blood-brain barrier. It prohibits most microorganisms from passing to the central nervous system. However, a downfall to this is that some drugs and antibiotics might not also be able to pass through the blood-brain barrier. And if that's the case, and you need to use a particular antibiotic that is not compliant or consistent with the blood-brain barrier, oftentimes what you'll have to then do is put a direct shunt into the ventricle, which would allow access to deliver the drug right into the CSF. Because if it's not going to be able to pass through that blood-brain barrier, it's not going to get to the tissue where it might be needed. Immune privilege of the central nervous system. A different or partial immune response when exposed to immunological challenge. Functions of the central nervous system are vital for life of an organism, and temporary damage from normal immune responses could actually be detrimental to the central nervous system. Because of that, where a normal immune response might actually damage some healthy cells in the process, you do have this immune privilege. Cells in the central nervous system express lower levels of MHC antigens and also lower quantities of complement proteins. You do have microglial cells that are resident macrophages, and they do display phagocytic activity. There's also brain macrophages that exist in the central nervous system, and activity of both types of cells is less than that of phagocytic cells elsewhere in the body. Now, as far as normal biota of the nervous system, it is still believed, and it has long been believed, that the central nervous system and the peripheral nervous system are what we call sterile sites. They lack normal biota of any kind. Finding microorganisms of any type in these tissues represents a deviation from a healthy state. Certain viruses live in a dormant state in the nervous system between episodes of acute disease. For example, herpes simplex virus will live in the trigeminal nerve, the ganglia of the trigeminal nerve, or the sacral nerve if it's HSV2. And when it reactivates, that can lead to a particular outbreak, but it is not considered normal biota with these residents. It's not considered normal biota with these viruses that are in latency. Now, information from the Human Microbiome Project is revealing a potential link between the gut microbiome and the nervous system. Gut microbiota may induce central nervous system autoimmunity. It appears to cause changes in brain chemistry and behavior, and this is a phenomenon that's known as the gut-brain axis. So just a little recap on the system and normal biota with the nervous system. Your defense mechanisms, you do have the bony structures, you have the blood-brain barrier, and these microglial cells or macrophage cells that are resident within the central nervous system tissue. As far as normal biota is concerned, there is none. It is considered a sterile site. Let's talk about our first disease, meningitis. This is going to be inflammation of the meninges. It's an anatomical syndrome. Different microbes can cause meningitis. It's pretty much anything that's infecting those tissues can lead to meningitis. It's an inflammation of the meninges. That's what it's defined by. Non-infectious causes of meningitis exist as well, but they are much less common. Serious forms of acute meningitis are caused by bacteria. If it's viral meningitis, it's less severe, and oftentimes that will resolve itself over time. Entrance into the CNS, central nervous system, is facilitated by co-infection or previous infection with respiratory viruses. So, what happens when meningitis is suspected? Well, they will do a spinal tap, which is a lumbar puncture, to obtain some CSF. They will then do a gram stain and our culture of that CSF. And then they will begin treatment with broad spectrum antibiotics with a shift in treatment after the diagnosis has been confirmed. So some signs and symptoms of meningitis. Meningitis has the following symptoms, regardless of the cause: photophobia, which is sensitivity to light, headache, painful or stiff neck, fever, increased white blood cell count, especially in the cerebrospinal fluid, and certain microorganisms that may cause additional characteristics, symptoms. Now, the important thing here is, headache, stiff neck, painful neck, or fever. These are not necessarily symptoms that might send you running off to the emergency room either. So sometimes this can be a little tricky. Meningitis can manifest as an acute or chronic disease. Some microorganisms are more likely to cause acute meningitis, and others will cause chronic meningitis. In a healthy person, it is difficult for microorganisms to gain access to the nervous system. Successful microorganisms have specific virulence factors which aid in the pathogenesis of them being able to infect this sterile site or this area of the body. So the first one is Neisseria meningitidis. This is a gram-negative diplococci. Here you can see the two diplococci lined up side by side. It's also known as meningococcus. It's associated with epidemic forms of meningitis. Causes the most serious form of acute meningitis. And and it's actually responsible for approximately about 15% of all cases. Looking at the dissemination of meningococcal from a nasopharyngeal infection, the initial infection site, which could be in the palate, the nasal cavity, meninges, CSF, here you can sort of see the dissemination of the meningococcus from a nasopharyngeal infection. Bacteria will spread to the roof of the nasal cavity, which borders the highly vascular area at the base of the brain. From this location, it can enter into the bloodstream and escape into the cerebrospinal fluid, leading to an infection of the meninges. So this is how you can really see, this particular infection starting off as a simple respiratory infection and potentially getting into the meningeal area there. Continue with Neisseria meningitidis here. Excuse me, meningococcemia. This is rare. It oftentimes will have a very high mortality rate. What happens here is the endotoxin acts as a potent white blood cell stimulator, and what you get is damage to the blood vessels, causing the release of cytokines by the white blood cells, will lead to vascular collapse, hemorrhaging, and crops of red or purple lesions on the trunk and the appendages. And again, this can be very fatal. The test for Neisseria meningitidis is an oxidase test. A drop of oxidase reagent is placed on a suspected Neisseria or colony. If the colony reacts with the chemical to produce a purple to black color, as you can see here, the oxidase was placed there. If it does produce this purple to black color, it is oxidase positive. Those that remain white to tan are oxidase negative. Because several species of gram-negative rods are also oxidase positive, this test is presumptive for Neisseria meningitidis and needs to be followed up with typing. Okay, Streptococcus pneumoniae. This is also referred to as pneumococcus. And this is we're going to see this guy again when we get to the respiratory system because it can cause pneumonia, the causative agent for pneumonia. Most frequently, it's the cause for common community-acquired meningitis. It does not cause the sort of hemorrhaging that we see with the Neisseria meningitidis. And this will most likely occur in patients with underlying susceptibilities. Carriage rates exceed 30% in some populations. Streptococcus pneumoniae is a small gram-positive flattened coccus that appears in end-to-end pairs. Streptococcus means it's a chain, so that's what we mean by end-to-end pairs. It's distinctive in appearance and in a gram stain of the CSF. It'll come back as gram-positive. It has a polysaccharide capsule that protects it against phagocytosis. So the fact that it has that capsule and can evade phagocytosis is a virulence factor that is associated with this particular organism. It does produce an alpha hemolysin and hydrogen peroxide, both of which have been shown to induce damage to the central nervous system, and we can actually test for both of those things in the identification processes. There are also several vaccines that are available for Streptococcus pneumoniae. Again, mostly they're administered for pneumonia protection, but they do provide cross protection against meningitis. Haemophilus influenza, this is a gram-negative coccobacillus, causes one of the most severe forms of meningitis in humans. It's often called Hib because serotype B is the most common cause of the infection. Hib stands for Haemophilus influenza type B. Vaccination has reduced asymptomatic carriage rates and virtually limited Haemophilus influenza serotype B in the United States. Very common childhood vaccine that's administered. Listeria mitocytogens, this is a gram-positive, ranges in morphology from coccobacilli to long filaments in palisade formation. It does not produce capsules or endospores. It typically will have 1 to 4 flagella. And it grows inside the host, moves directly from an infected cell to an adjacent healthy cell. Listeriosis, this is mild or subclinical in healthy adults. However, it can lead to meningitis and septicemia in the elderly, immune-compromised fetuses, and neonates. Bacteria for Listeria can also pass through the placenta, causing premature abortion or fetal death. And it's oftentimes associated with contaminated dairy products, poultry, and meat. And it's recommended that females that are pregnant to stay away from things like soft cheeses and any sort of raw preparations of meats. Streptococcus neoformans. This is a fungus that causes chronic meningitis with a gradual onset of symptoms. In AIDS patients, it's a pretty fast onset with acute disease. It's not something that we typically see in people that have a competent immune system. In this particular image here, you can see halos around large spherical yeast cells that are thick capsules. You can also see that they can form buds from one cell, coming off of one cell. And encapsulation is a useful diagnostic sign for Cryptococcus, although the capsule is fragile and may not show up in some preparations. Coccidioides, this is valley fever. This is a fungus with a very distinct morphology. And this is a true systemic fungal infection that has very high virulence, and it can also cause a lot of issues. In this picture here, we have the arthrospores are present in the environment, and these arthrospores can be inhaled. And in the lungs, the brain, or other tissues, the arthrospores will develop into spherules filled with endospores, and the endospores are then released to induce damage. And here you can see the spherules that are filled with these endospores in the tissue. Coccidioides is very, very rare in the US, but any cases that we have had have been in the Southwest area, really the Mojave Desert area. So those are all different types of bacterial and fungal types of meningitis. Viral meningitis, 4 or 5 meningitis cases are caused by one of a wide variety of viruses. Aseptic meningitis, this is viral meningitis, is assumed when a patient shows symptoms of meningitis, but they are not able to identify any bacteria or fungal species from the CSF. Viral meningitis is the majority of cases in children. It's also 90% of these viruses are caused by enteroviruses. HSV2, which is herpes, has been known to sometimes cause meningitis. And as I mentioned in the onset, the viral meningitis oftentimes is much milder than bacterial or fungal meningitis, usually resolves within about 2 weeks, and mortality rates are less than 1%. And, you know, here, as you saw from the chapter 18, there are these sort of summary tables that go over essentially, you know, like the mode of transmission, some virulence factors, prevention, treatments, some distinctive features. And here's the tables for our cases of meningitis. Neonatal and infant meningitis, this is usually the result of an infection that's transmitted by the mother in utero or during a passage through the birth canal. As more premature babies survive, rates of neonatal meningitis can increase. The morbidity has increased, but mortality rates have significantly declined. 2 most common causes are Strep agalacia and E. coli. This is also referred to as GBS. All pregnant females in the 3rd trimester are tested for GBS. And if they are GBS positive within the vaginal tract, they will actually treat with penicillin just prior to giving birth to protect to protect the fetus. So group B Streptococcus, this colonizes 10 to 30% of females in the genital area, the vaginal tract. It's also the most frequent cause of neonatal meningitis, and it's treated with penicillin, like I said, right before giving birth, if the female is GBS positive. And again, this is a common test that's done in the US within the 3rd trimester. E. coli, this is most common in premature babies. The prognosis is poor with about 20% mortality rate. This can lead to brain damage among those who actually survive. And again, this is passed from the mother to the fetus through the birth canal. And then here's just a table summarizing the neonatal and infant meningitis. Okay, sorry. So meningoencephalitis, encephalitis is inflammation of the brain, and we're going to stop right here for the first part of the recording, as I have to run off to a class. And we will pick up with different types of organisms that can lead to encephalitis.